really appreciate Miss Alison for your time and the support this time. So before our interview, could you please introduce a little bit yourself and your work and your center? Okay.
Yeah. Hi, my name is Alison Newman. I'm a program operations specialist at the University of Washington at the Addictions, Drug and Alcohol Institute Center for Community Engaged Drug Education, Epidemiology, and Research. And what that means is we like to go out into the community, talk to people, hear from them, and develop programs based on research, um, from what we learned from the community and really try and create programs that will work for people. So part of what I do is I work with harm reduction programs, which are also known as certain service programs, to do a survey every other year and to do qualitative interviews with people to find more out about what drugs they use, what kind of help they want, what they value about their programs. So really, a lot of what I do is talking to people and learning from people, and I also host webinars and do education for the public about harm reduction and overdose response.
Well, it's really a lot of jobs because it's really a big issue now. So based on your work, especially your work across the states to supporting the harm reduction programs and providing data driven evaluation. So our the first question is that from a statewide perspective, what are the most present present challenges in delivering, effective overdose prevention education in Washington?
I would say a huge challenge for delivering effective interventions for people who use drugs, including people at risk for overdose, is stigma. There's still a lot of stigma around drug use. And what I mean is people have really negative opinions often about people who use drugs and even some of the approaches that we use to help them. So harm reduction is this idea that people often know how to stay healthy and that the best approach is to give them lots of options for how to stay healthy and that any kind of positive change is a really good thing, that we don't need someone to change overnight, that any kind of approach towards health is really beneficial. However, there's a lot of stigma around these approaches, things like syringe exchange, giving out safer smoking supplies. We know that these are interventions that can help people stay healthier, that can help avoid the spread of HIV or hepatitis C. However, there's a lot of stigma around them. People might have negative opinions about these programs, even though they're effective. And similarly, there's still a lot of stigma around the medications that are used to treat opioid use disorder. So, opioid use disorder is when someone's opioid use is hard for them to control. It starts to have effects on their um, relationships, their thinking. They might want to stop using, but have trouble doing so. And we have medications that are really effective to help this. However, there's still a lot of misconceptions about those medications where people think, oh, that's just trading one drug for another. Or,
Mm.
oh, I think it's better just to stop using without any help. So I think just these perceptions around things like harm reduction and medications remain really substantial barriers.
Yeah, yeah, I can understand that because I think this year before we trying to participate with homeless people, like the food delivery program, but it's driven by religion groups.
Mm.
So when we try to deliver food with some useful information, like you mentioned the exchange needle program or some
Hmm.
other informations, they don't allow us to do that. They just feel like that things is not good for drug users. It just like they 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 think that that program encourage them to use more, but
Yeah, and what you're
that
saying we hear a lot, which is the idea,
mm,
oh, if you give people safe supplies to use, they'll just use more. And what
mm,
we know both from the research we do and other bodies of research is that harm reduction programs and non-judgmental programs actually just help people be healthier. That
Mm,
it's more likely that they'll continue to engage in services if you provide them things that are useful to them and provide them a place where they don't feel judged. And for some
mm,
people, that means that eventually they do get connected to treatment. For other people, they might start to use less. So that connection is really important. So keeping people connected into care, even if they are never ready to stop using, it's really important for helping um, reduce the negative effects that they might experience from drug use and also negative effects on the community. So
mm.
something like syringe exchange helps keep syringe litter off the street. Um, and we know one of the main reasons syringe exchanges were started was to prevent transmission of HIV, which still remains a really important piece
Yeah, yeah.
of that.
Yeah, okay. Thank you for that. And we can move to another one. So you mentioned, yeah, just now, you mentioned some kinds of different harm reduction approach. So based on your experience, what type of um, like the training or capacity building activities have proven most effective for improving the overdose prevention outcomes?
Yeah, that's a great question. Naloxone distribution is highly effective for overdose prevention.
Mhm,
Naloxone is also known as Narcan. It's a medication that can block the effects of opioids and help reverse an overdose.
mhm,
And originally, naloxone was just used by EMTs or doctors or nurses
mhm,
to reverse an overdose. But through harm reduction programs, they figured out we can purchase this and we can distribute it to people who use drugs and their friends and family, and we can train them on how to reverse an overdose.
mhm,
And that's now spread. Like a lot of people carry naloxone. I carry naloxone. I give it out to people. I put some in my community pantry.
mhm.
Um, and yeah, you've got some.
Yeah,
And so we know it's really an effective intervention to train people on how to recognize the signs of overdose and to hand out naloxone. And we know from research that it's most effective to give it out to people at risk of overdose and their friends and family. So people who are likely to witness an overdose. I think the other piece of it is it gives people who are concerned a way to learn more about the issue and something that they can do to help, which is
mhm.
also really powerful. So I would say for reducing overdose deaths, naloxone is super effective. Naloxone, however, only lasts for 60 to 90 minutes that it reverses the overdose. So the other piece that's really important is creating low barrier programs where people can get that connection and even access things like medications. So in Washington State, we now have a few sites that are known as health hubs that offer syringe exchange, safer smoking supplies, primary care, mental health care, and substance use disorder treatment, including medications for opioid use disorder. So this is a kind of one-stop shop model where someone can go, not feel judged and get help for a whole bunch of different things um, that they're worried about. And we think that's a really effective model for reaching people and making it easy for them to stay healthy.
It's great. I know that now a lot of not just clinics, but also like libraries, people can find to get the Narcan. It's really a great job. And um, can you tell us like how people can reach out to the you said the one stop clinic um, or facility to help them how they can find the nearest one or
Yeah,
some place to help them.
yeah, for finding naloxone, that's really easy. You can go
Hmm.
look up naloxone map. Washington Department of Health runs the naloxone map where you can find free naloxone or have it sent directly to your house.
Hmm.
That's a great option if you're just interested in naloxone. The health hubs, I think there is a web page that describes where those locations are. I want to say there's only 5 or 7 in the state that are funded. However, we do also have a big network of syringe service programs that offer a range of things. Some of them, are community-based and run by people who use drugs. Some of them are run through health departments. Some of them are like a nonprofit, and they offer like a different range of services. And you can find that also by looking at Washington State Syringe Services programs.
Mm.
And then the other piece is if people are interested in finding access to medications for opioid use disorder, the Washington Recovery Helpline has a web page and a phone number that people can use to find that information. So we do have different ways to find good information out about, how people can stay healthy. And if people want to do something helpful, getting trained on naloxone is a great start. Volunteering at a syringe exchange can be really powerful. Also, um, the people who work there and the people who go there are really great. It's a good chance to just go and learn more about things.
Okay, great. I think I will after the interview, I will do some research and add all this information on the screen. When people watch the video, they can easily find the way to access all this approach. Thank you. Thank you. So, um, it's great to know, we already have a lot of resources to help
Mhm.
the people who have the drug addiction or similar problem. But from my personal experience, we also do some, in-person education events in some of the, the mini village and shelters, and we talk to people, residents there, and do some survey related to their drug use experience. And we just find that they told us they they saying use that saying, but they we feel like they do not wants to drop them or change the lifestyle.
Mhm.
So, do you can you give us some suggestion that how to make all these education events, more impactful? Could,
Mm.
truly help people um, to know the ways could help them, or how we can design more effective materials to to deliver all these kinds of good resources to communities.
So you've already done the number one thing I would recommend, which is going out and talking to people and
Mm,
hearing from people what they think.
yeah.
So I've already done sort of the first most important step, which is hearing from the community, sort of what they think about the issue and understanding what barriers there might be. So I think that's a really important thing is just to go talk to people, hear from people, um, and then be open to the fact that people might not be ready to change right then, but they might want information. Or maybe what I find is really powerful is a lot of people want to be a helper. So naloxone is great because you can distribute it to someone and they
Hmm.
can use it to save someone else. And that's a really great entry point to having a
Yeah.
conversation about how you can help your community. People don't always want to be seen as the recipient of help. People often want to be someone who's helping others. So
Mm,
framing it as maybe you can talk to people about medications, like, hey, can I talk to you a little bit about this? You might be able to help someone who's interested in this topic. So not just being like, there's something wrong with you, here's what you can do to fix you. Maybe
yeah.
being like, here's options that might work for you or might work for someone else. Just become educated about it. And then also making sure the programs or services you do refer people to are appropriate and are low barrier
Mm,
and are comfortable for people. Because
mm,
in some parts of the state, there may be services available, but they may not be a good fit for all sorts of different reasons. So there's two things. One is you can educate people about what's out there, but you also have to make sure that enough services exist to send people to. So you have to
Mm.
build things out at the same time. It doesn't work to educate people about an action that you want them to take that they can't really take.
Yeah, yeah, that's really good and very important that yeah, we just before we just like participate in some these communities events like the Halloween event and we give some candies to kids and during that time and we also deliver some like hygiene kits to residents and to show our friendly and try to build some trust and then we start to have a chat with them and introduce ourselves and some resources. Yeah, and yeah, we will keep to that. Thank you. Your and based on your work, especially to the survey, the interview work with people who use drugs. So, what are the essential needs for these people, and what things you suggest that we can do? I mean, besides what you mentioned before.
So I think it's important to sort of differentiate that so everyone's an individual and
Hmm.
people have different individual needs, but there's also sort of different groups of people who've been affected by the overdose crisis. There are long-term people with opioid use disorder who maybe started on heroin or prescription pills and have now switched to fentanyl because that's what's available. They may have different needs than the people who started on fentanyl and are addicted only to fentanyl. And then there's also young people or people who are using drugs recreationally who don't have opioid use disorder, but maybe at risk for overdose just because of the fact that the drug supply is super variable.
Mm,
So, for example, if you went to the store and bought a beer, like you could look at the percentage of alcohol in that beer and have some idea how that might affect you. Our drug supply, illicit or illegal drug supply, is not like that at all. Be like if you
yeah.
went and bought a beer, but maybe it had just a little bit of poison in it, or like 90% alcohol when you expected, 6%. So, or some mystery ingredient that just showed up. So, part of the issue right now is that the drug supply is really dangerous and changes a lot. And we have some insights into what's in the drug supply because we have a drug checking program in Washington State where people can bring in their drugs and have them tested. Um, so that group of people who's at risk because they use drugs recreationally but doesn't have opioid use disorder, that group of people may need different programs and interventions. They may need stuff like fentanyl test strips. They also need naloxone. They don't
Mhm.
necessarily need all these other wraparound services that we would provide people. They probably just need some education and some sort of light harm reduction tools to help them avoid overdose or to avoid dying from an overdose. For people with long-term opioid use disorder, we think that they probably need um, really like a lot more. So probably they would benefit from when we talk to people, they say they would like programs that are easy to access, that are supportive, that are non-judgmental, that will also help them with things like housing or mental health or food
Yeah.
security. So these other really basic life things that people say, I can't deal with my drug use until I've also dealt with these other things in my life. So often people um, are using drugs for a reason, if
Hmm.
that's coping for pain. Maybe they started recreationally but developed a substance use disorder and now it's really hard to stop. But those people probably need um, more intensive services. And when we talk to people, they really want us to address other priorities too. Like we may look at someone and be like, well, I think their drug use should be their top concern. But we actually have to talk to them and ask them, like, what is your top issue? And work with them on that top issue, along with anything else they identify. So really have people identify what's going to work with them and have programs that can treat people holistically rather than
Hmm.
as just one thing. And I don't think our
Mm.
system is always that effective at doing that.
Yeah. That is true. Like, because all the people why they use drugs, the reason is very complicated and case by case. So, like, uh, some like community based organization like us, we can deliver the useful information resources, but we cannot help them to find a stable housing. So
Hmm.
um, that is true. Sometimes feel a little bit, powerless when we work with these people. Really want to help them, but sometimes just feel we do not have, enough ability and the resources to fulfill all their needs. So, but from your perspective, what do you think we can do? Some jobs in in this field can really help people and to, not even improve a little bit. We are willing to do so. Hope we can have some suggestion from you.
Yeah, I think um, creating information in ways that is easy for people to understand and
Mm-hmm.
putting out in different ways is really good. So, SAMHSA, the Substance Abuse Mental Health Service Administration, had like a 60-page flyer on
Mm-hmm.
medications for opioid use disorder. That's really long and not that accessible for people. So we made a 4-page, a quad-fold brochure. It doesn't
Mm-hmm.
cover everything, but hopefully it has enough information to help people start to think about medications. So putting out information in ways that's accessible and appropriate. We put a lot of thought into what images we use, the language we use, really trying to get everything to like a sixth grade reading level or lower,
Mm-hmm.
because that's the average reading level that American public can understand. And also just really leading and doing the work with compassion. So doing a lot of listening, asking questions, trying to connect with people, and being open to the fact that things keep changing. So we've seen, even in the time I've been in my position, which is 8 years, I've seen a lot of change in both what services are available, the drugs people use, um, the legal landscape. So things just keep changing. So being flexible is really important for reaching people.
Mm. Thank you. Thank you.
Yeah.
Appreciate your insights and share a lot of such useful resources. Thank you.
Yeah. I'll
Thank
send
you.
you an
Yeah.
email probably first
Hmm.
thing tomorrow. So,
Yeah. No hurry because it's nearly the holiday. So
yeah, I know it's
yeah.
exciting.
Hmm.
Short week.
Hmm.
So,
Yeah. Okay.
but
Thank you. Thanks for your time. Yeah,
yeah, thanks so
today.
much. You were a great
Hmm.
interviewer.
Hmm. Thank
So,
you. Thank you. I'm just still learning.
oh,
Thank you.
you did really well. Your questions were really good and thoughtful.
Okay. Thank
So,
you.
all
Thank you.
right.
Hmm.
Thank you. Bye.
Thank you. Bye. Happy holiday.